Keynote 189 study is practice changing. This was a trial that looked at the role of adding pembrolizumab to carboplatin pemetrexed versus carboplatin pemetrexed for patients with advanced stage non-squamous non-small cell lung cancer. And there's been a lot of evidence that obviously immunotherapy works as a single agent drug in the second line for adenocarcinoma. So this was moving it up in Frontline. And the trial was a very clean study, and the results were surprising. Patients in the triplet arm, carboplatin, pemetrexed, pembrolizumab, had an improvement in response rate, had an improvement in progression-free survival, and importantly, had a meaningful improvement in overall survival, no matter what their PD-L1 was. Now, the PD-L1 high expressors derived more meaningful benefit, but even in the patients with a PD-L1 less than 50%, there was a benefit in terms of both PFS and, more importantly, OS. So this triplet therapy, based on these results, I think has changed the way that we think about lung cancer and the way that we treat it. I would argue that every patient that has advanced adenocarcinoma that does not have an actionable mutation like EGFR ALK should be considered for the triplet therapy. It's hard for me to believe that an FDA-approved regimen now with carboplatin, pemetrexed, and pembrolizumab won't change the way that the NCCN thinks about using these drugs. I would argue, and people that I've spoken to, I think it's very hard to argue with this data right now. I think it was surprising for us to see. I mean, this kind of runs against what we're trying to do with precision medicine. We're just adding a drug to a platinum doublet and comparing it to a platinum doublet alone. But when you see this robust of a benefit, it's hard to ignore. So I think the NCCN will certainly adopt this regimen.